Before we get started, I want to take a moment to recognize some very special guests in the room tonight. We are honored to be joined by Dr. Dalen's son, Jim, and his wife, Suzanne. We are also delighted to have Dr. Dalen's wife, Priscilla, joining us this evening via Zoom. Thank you so much for being here. Your presence tonight means the world to us, and I know it means a great deal to everyone in this room. So if you don't know Dr. Dalen, Dr. Dalen's story is one that I will never get tired of telling. He came to the University of Arizona as Dean of the College of Medicine, served as the Vice President for Health Science, and was absolutely instrumental in bringing the College of Public Health into existence. And then in 2008, he and his wife Priscilla established this lecture series because even in retirement, he couldn't stop investing in the future of public health. That's who Jim Dalen was. We carry his legacy forward with a lot of love and a lot of pride. So now for tonight's topic, standing the watch for global health security. I think we can all agree that this is exactly the conversation we need to be having right now. The world is changing fast, and the challenges to global health are real, and they are urgent, but so are the opportunities, and that's what makes tonight so exciting. There is truly no one better suited to guide us through this conversation than our distinguished speaker and our own alumnus. Dr. Richard Carmona grew up in a poor immigrant family in New York City, where he experienced homelessness, hunger, and health disparities firsthand, experiences that would ultimately shape his life work. After dropping out of high school, he enlisted in the US Army, earned his GED, and went on to serve as a Special Forces combat decorated Vietnam veteran. He then pursued his education with a vengeance, graduating the top of his class from the University of California, San Francisco School of Medicine, winning the prestigious Gold Cane Award. Dr. Carmona came to Tucson as a trauma surgeon and established the first trauma system in Southern Arizona. He also served for over 35 years with the Pima County Sheriff's Department, becoming one of the most highly decorated law enforcement officers in Arizona. He later earned his Master of Public Health here at the University of Arizona, making him a proud graduate of this very college. He went on to serve as the 17th Surgeon General of the United States and today serves as a distinguished Laureate Professor at the University of Arizona Zuckerman College of Public Health and a Chief Health Innovation at Canyon Ranch, continuing his lifelong commitment to prevention, preparedness, and health equity. And tonight, he is home. Dr. Carmona, thank you for being here. We are so glad to have you with us. Please join me in giving a warm welcome to our own Dr. Richard Carmona.
Well, I think Iman has outed me that I'm a recovering surgeon. It's interesting and important that she mentioned that because I was recruited here by the university and TMC to start the first trauma emergency medical system that was certified. And probably worthwhile mentioning how I made the transition. After a decade or so, the program was very successful. We had medical students, residents, fellows, we were training. But I started to realize that almost every patient I was caring for was there with something preventable. And so as a professor, I went back to school at night here at Meskov in one of the earlier classes to get my master's because I needed to know more about the business of medicine and public health. And gradually, I just went away from being a trauma surgeon and a critical care doc and pretty much immersed myself in public health, which is where I've been the last few decades. So people find it a little bit strange that you gave up, being a surgeon and so on. I think actually it made me a better public health professional because the things I talk about now are not theoretical. I was the guy taking care of people and fixing them after they made bad mistakes and such. And I need to give a shout out to Iman Hakim because besides being a friend and a mentor, she has surpassed all expectations in building our College of Public Health here. So please, Iman. So today I would like to speak to you about standing the watch for global health security. And notice the subtext of that is a Surgeon General's call to action. So I want to explain both before I get started on the narrative. The comment or the statement standing the watch is something we use in the military often, but it goes back centuries. And it's a term bestowed on those who through hot and cold and night and day, that person or persons that are always there watching over you so that you could sleep safely, so that you're able to carry on whatever duties you want. And those are people that we refer to as standing the watch in general. So standing the watch for global health security and the Surgeon General's call to action. The second part of that I don't expect you to know, but I want you to understand, one tool that the Surgeon General has in executing the job description, which is to protect, promote, and advance the health, safety, and security of the United States. So a call to action is a way you can inform the public and elected officials, if they're listening, about issues that are germane to the health, safety, and security of the nation. So you've all heard about Surgeon General reports. Those take a year or two because there's a deep dive on any subject. CDC is involved, NIH, many different groups. But a call to action is when you see something in the environment and you go, I can't wait for a report. I need to get this out to the public because these issues are germane today to the health, safety, and security of our nation. Hence why I put it together with Global Health Security, a Surgeon General's call to action. And who better than to emulate all of this? My friend Jim Dalen, who... Yes, I will. I wanted to just, I was just getting instructions, and my dean takes care of me. Jim was my dean at the medical school and was here when I ran the trauma program. I got to know him very well. And of course, an extraordinary supporter, proponent of public health as a cardiologist. So I think it's fitting that this lecture fits under his name, and son and daughter-in-law are here with us tonight. So it's truly an honor to be able to deliver the James Dalen Memorial Lecture. Dr. Dalen's career represents the very best of academic medicine, rigor, integrity, and a lifelong commitment to advancing science in the service to others. It is in that spirit that I join you this evening with this call to action. And so we are living through one of the most consequential inflection points in modern history, where the forces of division are accelerating faster than the systems designed to hold us together. And I would like to begin with a simple but increasingly urgent premise. Global health is the foundation of global security and stability. And without it, peace, prosperity, and security cannot endure. If you remember nothing else from this presentation, it's this. Health is the foundation of stability. Stability is the foundation of peace. And peace is the foundation of human progress. We are living through a period of profound global strain. Across regions and across systems, we are witnessing mass migration, war and regional conflict, political instability, famine and resource scarcity, changing environmental conditions that are in some cases aggravating and in others directly driving patterns of disease, displacement, and instability, and the rapid spread of misinformation and disinformation. Each of these forces is destabilizing on its own. Together, they create a compounding risk, a level of systemic stress that challenges not only nations, but the global order itself. And what connects all of these forces is health. Health is the common denominator. War destroys it. Migration strains it. Famine erodes it. Misinformation undermines it. Political division fractures it. That's the world we are living in today. We are now seeing diseases once confined to specific regions expand into new geographies, reflecting the combined effects of environmental change, population movement, and global connectivity. Health is both the first casualty and the pathway to recovery. As the Surgeon General, my responsibility was not only to address illness, but to anticipate threats to health, safety, and security of the nation, and at times our allies, when they needed assistance. For although often geographically separated, we are all inextricably tied together or divided by our public health. Increasingly, those threats did not originate in hospitals. They originated in instability. We often speak about these issues in geopolitical or economic terms, but the true cost is measured in human lives. Lives lost, lives permanently altered, families displaced, communities destabilized, generations impacted. Today, more than 100 million people are forcibly displaced worldwide, the highest number ever recorded in civilization. And yes, there is an economic cost. Instability drives migration. Migration strains systems. Strained systems destabilize economies, and unstable economies threaten global markets. But beyond dollars, the greatest loss is human potential. Unrealized, interrupted, or gone. We have faced moments like this before. At the end of World War II, the world stood at crossroads. The response was not to retreat, it was leadership. The United States, working with partners, helped build a framework for global stability. On this slide, you can see many of those organizations. The United Nations, the World Health Organization, the World Bank, NATO, Voice of America, USAID, PEPFAR. Very importantly, we invested in science and public health and infrastructure. Look hard at that slide, because many of those organizations are being deconstructed as we speak, and the catastrophic consequences will not be realized for some time. But in communities all over the world who depended on us, bit by bit, they will feel the pain of what happens when they can't eat, when there are forced migrations, when there are wars because of this, all of these things. Think about the wisdom of the Marshall Plan, which I'll mention in a minute. And the reason I bring that up, after World War II, the Germans and the Japanese were our enemies. Yet one of the field commanders, General Marshall, came up with a plan. When many Americans countered and said, no, they're our enemies, don't help them. He said, if we don't do something as a nation, they will be our enemies for life. If we help them rebuild and become democracies, we will have allies for life. He prevailed, fortunately, but that brought great stability to the world. Think about the forethought back then. There was no internet, there was no, how do you communicate that? Yet with perseverance and persistence, they stuck with it and gave us the world that all of us here grew up in, one now that is being challenged. Again, I'll look at some of these, and as Surgeon General, with President Bush, we moved forward PEPFAR, which dramatically reduced the spread of AIDS globally. That has been defunded, it doesn't exist anymore. The Voice of America has been muted, and that was the US's opportunity to project public health and help educate people around the world. That's gone. The World Bank is still there, fortunately, but they're struggling as well. The World Health Organization, we have removed ourselves from that. And that was an organization, apolitical, nonpartisan, solely focusing on what connects us, health. The United Nations came from World War II as well, as you know, and they've been criticized, but underneath all the criticism, it is the organization that holds the world together through mutual approaches to peace and prosperity, again, around health. So that's why I'm not going to have many slides tonight, but I wanted everybody here to see the importance of what is happening today in our world and how it will lead to instability because of migrations and otherwise. We still have children in other parts of the world that are dying from malnutrition. Okay? And so some will argue it's not our responsibility. I feel we are all joined together by a common purpose as humanity. And so I would feel, because of the privileges that we enjoy, and many of you, looking at all of you, I know you'd agree with me because I know how much time and money you put into the community to help people who can't afford things. So I think it's just important that we all recognize that these are not mere transactions. They are changes that will have profound catastrophic consequences globally, as well as undermining our great credibility with many other nations. As I said, we invested in science and public health infrastructure, the National Institutes of Health, advancing discovery and innovation, the Centers for Disease Control and Prevention, strengthening global disease surveillance and response, and within that CDC was the Epidemiologic Intelligence Service. The group of doctors specializing in epidemiology we trained for the world. They're stationed all over the world. And not only to help people stay healthy, it is an intelligence service. It is giving us information every day on what's happening in the rest of the world so we can act accordingly, help somebody, but also prevent a disease from coming here. Think COVID. It started someplace else. It ended up in the Northwest and then decimated our country. Think AIDS. It started in Africa. And look, half a century later, it's still here. So the EIS is an extraordinary part of the CDC where they train epidemiologists not only for our country, but for others, and share information with others about disease that can spread in order to make the world healthier and safer. So that's some of the challenges that we're dealing with that potentially we could lose. The United States Public Health Service Commissioned Corps, one of the 8 uniformed services of the United States, traces its origins to 1798, when President Adams created legislation to care for sick and injured seamen because our whole economy was based on the waterways and sailors were getting sick. It was the first medical service. It was the first hospital. It gave rise to public hospitals and history of our nation. So today that same Corps serves on the front lines of public health with the Surgeon General as the commander. They are deployed all over the world, often invisible and anonymous, but doing what's right to make the world a healthier, safer, more secure place, and, being proponents of public health and being force projection of public health. They respond to disasters, deploying globally and protecting the health, safety, and security of our nation, and when needed, our allies. Together, these efforts did more than advance science. They were part of a deliberate strategy to prevent the conditions that lead to instability, conflict, and human suffering. They helped unify a fractured world around a shared commitment to health knowledge and our common humanity. And underpinning much of it, as I said, was that Marshall Plan. Now, this was not charity. This was brilliant foresight to know what would happen if they didn't move in that direction and create a United Nations and a World Health Organization and the World Bank and create stability. Because without that, we see the mass migrations and the instability and the wars. Today, many of those institutions and the principles behind them are under strain, and the consequences, as I said, are predictable. More fragile states, more displaced populations, more preventable deaths, accelerated spread of communicable disease, and a higher likelihood of conflict. When nations turn inward and abandon global health leadership, instability does not stay contained. It spreads. Misinformation and disinformation erode trust, polarize communities, and undermine science. And political divisiveness itself has become a risk factor for public health. During my travels as Surgeon General around the world representing our great country, I had the opportunity to visit many, many countries. And this is in a very remote village, no electricity, no stores, no vehicles, no phones, and no industry. And yet, there was a thriving culture. People cared for one another. They shared what little they had. They respected their elders. They lived in community. And there, mounted on a tree, was a screen which had a solar panel on it. And around the base of the tree were dozens of children gathered around it, watching Sesame Street in Arabic. Supported in part by American Global Engagement, our Voice of America and things like that. And what you're seeing was what we call soft power projection. We were connecting to a community that needed information. We were practicing health diplomacy. What were those children learning in the middle of nowhere in one of the most remote villages you can possibly think about? They were learning to share, to care for one another, to respect their elders, to value friendship, to build community. In that moment, something became very clear to me. Those children were not just being entertained, they were being taught the foundations of a healthy, stable society. They were learning behaviors that support health, resilience, and peace. And if we can teach children to value compassion, cooperation, and community, we are not just improving health, we are preventing the conditions that lead to conflict. And I came to a realization. The Muppets are not just characters. They are indeed public health ambassadors and public health force multipliers. In fact, I told Sherry Weston, the CEO of Sesame, who I know, I told her, you don't know what you have here. I says, this is a powerful, powerful tool to create peace, prosperity, and bring value to communities that have nothing. And to this day, I talk about the Muppets as health ambassadors. Think about that. Children who have nothing around a solar panel on a little screen in the middle of a village that is hard to even imagine how poor it is compared to our standards. And yet they're being educated about the very elements that are necessary to be able to thrive in community, society, health. So this is health diplomacy, and arguably one of the most effective global health interventions we have ever deployed. In fact, as Surgeon General, Colin Powell was then the Secretary of State. I had a conversation with him, and we were both being Army guys. I said, you know, Mr. Secretary, you should look at this. It's pretty incredible. And the pitch I made to him, General, remember, Sesame Street is translated into 70 languages, is delivered to 156 million children globally in 150 countries. Name me one other export that we have in our nation that does good, that does that, and touches the world. How simple, and it was in front of me and others all the time, but standing there in the middle of nowhere, listening to it in Arabic, watching smiling faces and kids who aren't eating enough. Yet, it's seared in my mind how happy these people were and the community they built and how they were hanging on every word that each Muppet said. Think about the power of that simple thing as a public health tool. Global health is not just about preventing disease. It is about preserving our shared humanity. Global health investment is not charity. It is strategy that can result in health, peace, and prosperity in a very challenged world. Wherever you sit, think about strengthening the systems, protect truth, build trust, serve people. Without those elements, we cannot prosper. We will remain divided. If we fail to act, we will see more displacement, more disease, more fragile states, and a world defined by instability rather than cooperation. We have done this before, successfully. We have chosen unity over division, science over fear, and leadership over retreat. The question before us now is not whether we can lead, it is whether we will lead. Because in the end, global health is human health, and our shared humanity is the foundation upon which everything else depends. Thank you.
Okay, we can have that come down, that would be great.
Thank you very much. I'm Professor Albrecht Klaas in German Studies, representing College of Humanities. And I would like to quote, first of all, my dean, who has said recently and repeatedly, the humanities are everywhere. And why? You just have talked not only about public health, you have talked about the humanities, humanity. And I would like to say, as a representative of my college, that dealing with words, language, you emphasized the Muppet Show, that brings happiness, happiness brings health, health brings peace, and peace brings stability.
Thank you so much. I appreciate your comments, sir. Thank you.
Good evening. This is Lupita Murillo.
Yes. Hi, Lupita.
Hi. I remember you very well when you started the Trauma Center at TMC. I covered the stories and covered you when you were in SWAT. You were a homicide detective. Been there with you every step of the way. But when you were Surgeon General, what event did you remember the most besides the one in Africa here? Or
That's a tough one. There were several. I would say a few meetings in the National Security Council when there were bad things going on, and it's kind of onerous when the leaders of our nation are sitting around with the president and they're discussing, and they come up with an idea, and then they say, ask the Surgeon General. Now, everybody's eyes are on you. In fact, I had this discussion with students today before I came here. I said, you realize the importance of the position you have? And there were several events, events like that. There were wonderful events like this one too. But I guess I would say, Lupita, in aggregate, being humbled by the extraordinary opportunity that I was given to serve my country as the Surgeon General, and 100 instances of meeting global leaders. Spent a lot of time in Mexico with Julio Frank, who I was just at UCLA yesterday giving a presentation with all the chancellors from the UC system. Julio Frank, when he left the Mexican ministry, and we worked on cross-border issues, and we treated it as if there was no border. We dealt with people. We weren't dealing with borders. That's political and artificial. But very smart guy, educated in the United States. He went on to be the dean at Harvard. Then he went to University of Miami. Now he's the chancellor at UCLA. So we reconnected yesterday, and it was amazing to have a discussion with him again of what the shared responsibilities we had a while ago. And all we did, trying to avoid the politics, let's say focused on what humanity, what the people needed. So it's all of those things that, what a privilege it is to have served, but always remembering that you put the people first. It has nothing to do with party, just what do the people need? And so I told the students that today when I was speaking with them, because they were asking me about their own futures. And I said, it's just pretty simple. Leave all the baggage outside and just always ask, why am I here? What is my mission? What is it I'm trying to accomplish? What's the timeline? What resources do I need to accomplish that mission? And who do I report to? Every mission was the same. And so to this day, I still, can't believe I had that opportunity, and all the, meeting world leaders, sitting at the table at the World Health Organization, being at the United Nations and addressing the United Nations, giving a number of commencement addresses at universities. You feel the weight of the position and the responsibility you have to elevate your game because you are representing the United States of America. It's all of those things.
Dr. Carmona, thank you for joining us this evening and sharing your perspectives, your insights, your experiences. I don't know how many people in the room will have felt what you were speaking and resonate with it, but for those who did, who want to take some sort of action, what do you recommend?
Well, I think it all starts at the grassroots level. If anything I mentioned here got your attention and you feel it requires change, it starts in a community coming together. Whatever the issue may be, whether it's vaccination, food for children, there is, it's in the military we call it a target-rich environment. There are so many things out there that you can go to make the world better, starting in our own community. And again, training here is wonderful with MESCOF because we're on an international border. We got 80 miles of border right below us. So think of the education our youngsters are getting here. It's not theoretical. You could see it every day. So, the border issue, I want to stay apolitical, okay, to be honest with you, but I see so many opportunities where we can come together in humanity and stop polarizing by political party or polarizing by anything else. I mean, it's all humans. We're all connected. We all want health. We all want peace. We want prosperity. So I think there's lots of things. And when I saw Julio Frank yesterday at UCLA, he gave me a big hug and he said, wow, we did a lot together because we put all that stuff beside us. We just said, okay, we have people here that want to work and they're poor. Let's figure out a way to have them come over here and work. They'll pay taxes. It'll help them. They'll go back to Mexico to help Mexico. And I'll give you a perfect example. When we had COVID, I was asked to be the incident commander for COVID here by the university president at the time. We put together a team that kept the university open, smartest people in the world right here at the university in an incident command system. And I started looking at the points of vulnerability in southern Arizona. We had the campus was good. We figured out a way to have athletics continue, but you couldn't have anybody watching the game. But the athletes got tested and they could play football, basketball, and did everything. And so that made, the revenue stream wasn't the same, but the kids kept playing. But one of the challenges that came up, Governor Ducey had asked me to help at the state level, so I was helping them put their program together as well. And I started looking at points of vulnerability down here, and I said, oh my gosh, we have lots of migrant workers that are all those farms and ranches picking food and doing things. And there's a term that we use in public health in general, where we're trying to identify essential employees. So if you have vaccines and you have to vaccinate people, who should get them first? Well, the doctors, the nurses, and so on. But I thought, hold it. I said, we need to get down there on those ranches and those farms to vaccinate those folks. And so I got pushback from politicians that said, well, they're illegal. Don't give them anything. I said, you don't understand. If they get sick, we all get sick. The virus doesn't recognize a political party or anything. And fortunately, the governor supported me, and we went down there. I met with a lot of the ranchers down there. And these are the problems that pop up. But we were able to get around it with good leadership and just not worry about which side of the border they were on or their political persuasion. This is a person that needed to be protected for themselves. And if we didn't protect them, they'll spread disease to others over here. Same thing happened in a number of other places where I was involved, that you have to just rise up above the politics of the issue. And you're a doctor, so you have to give. Often, the way I told the students today, one of the toughest jobs you have as Surgeon General, or even a physician or a public health director, is telling inconvenient truths to the politicians on both sides of the aisle. This is not partisan. Vaccines do work, period, okay? But there are some that don't believe it is. We provide the science, but then the misinformation and disinformation complicates it. So I think one of the things in public health now is being able to generate those narratives in a nonpartisan way, explain to people why these things are important, whether it was everybody getting a COVID vaccine or today flu shots and mis and disinformation about autism and things like that. The public is confused. They do not know who to trust anymore when elected and appointed officials make statements that have no scientific validity. The people that should be delivering the messages are the public health professionals, okay? Because they have no vested interest. And I think those are the most problematic things I think we have to deal with today, to be honest, practice with integrity, and in any position where you have been granted the privilege to be before the public, you must earn the public's trust every day, or you will be ineffective in your job. And that means, getting down and go to meetings, community meetings, and back to the original question, it starts in that community for the change. Whatever it is we want to do, we get together. We go to our elected officials who have the authority. One of the things I tell my graduate students all the time, because they complain about the parties, I said, look, the parties don't own the democracy. We, the people, own the democracy. We entrust them with the democracy, and they need to carry it out the way we want. And if they're not, we need to hold them accountable. It's a pretty simple system. But we, the people, need to rise up and speak and say, well, we don't like that. We elected you to do something, and you're not doing it. But nonpartisan, I'm just saying, that's the rudiments of democracy. And I think it's the beauty of what the Founding Fathers figured out 250 years ago, without the internet, okay? But basically writing stuff on parchment, giving it to a guy on a horse to ride to the next town, to read it at a town square. And somehow they all got this together. And 250 years later, this document still, it not only resonates, it holds true to all the values that we want to be as America. That's what we need to fight for, and it starts with the people in the community. Other comments, questions?
Thank you so much, Dr. Carmona, and thank you for your service. And my question is, what will it take, what do you think it will take for a doctor of public health to become a surgeon general?
Well, I think the only requirement by law is that the Surgeon General be a licensed physician, okay? And we just circumvented one that wasn't, so that was a problem. And many of us did speak out that that was pretty outrageous. So I never planned to be Surgeon General. I happened to be standing in the right place at the right time, was asked would I be willing to go back on active duty. To be honest with you, I never thought I was going to be confirmed or even get the job, because I have been equally caustic to both parties at different times. So I didn't try and make the political friends. I spoke inconvenient truths. I ran your county hospital here, the health system for a while. I was one who wrote, my master's thesis was amalgamating Keno into the University of Arizona. And so I just called it like I see it, but always looking forward to what's going to bring value to the citizens. That's ultimately what I'm being entrusted with. So the answer is always, you may disagree, that's okay, but this is the way it was for me. So I never planned to be Surgeon General. I was surprised when I got the call. In fact, Lupita will know, I first thought it was some of the police officers jerking my chain, to be honest with you. So I said, okay, and I went through the process, never thinking it was going to go anyplace. And then I kept doing interviews telephonically, and then I know they're serious because they pay for you to go to Washington. And then you start meeting with senior officials. And I remember when I went one time, and I was my wife and my kids, I said, I think they're serious. I mean, they're paying for me to come back to Washington now. And there were other people. But I remember telling my wife, I said, I have a good feeling about this. And I said, I think if I get to the White House and I make it to the West Wing, I'll get the job. And I remember one of my last meetings, I was in the West Wing. And in fact, I was holding the president's dog, Barney, waiting to be having an interview with some of the senior staff. And I went in, I had the interview with the chief of staff and personnel for the White House. And then he said, you did pretty well. I said, thank you. He said, when are you going home? I said, I got to catch a plane in a couple hours. He said, can you stay till tomorrow? I said, is there somebody else? He said, no more interviews. He said, the president would like to talk to you. I mean, it still gives me goosebumps because I figured, well, I'm not speaking to the president because he's going to fire me or tell me I don't get the job. That's what the hired guys do. And then, I called the family. I said, I think I got this job. Came home, and the rest is history. And then they only nominate you. Then you have to go to the Senate to get confirmed. And that's an arduous process. You meet multiple senators on both sides of the aisle, and they question you. And actually, it was a very good experience. I mean, most of them are pretty honest guys and ask you good questions. And you have to be able to hold your own. And then they give you the privilege to have the Senate confirmation, which is truly a privilege. Everybody doesn't get it. And you go before the U.S. Senate. You go before the Committee of Jurisdiction, the Health Committee, and then they vote at the U.S. Senate. And I was sitting in the House with the vote because I'd already had my interviews. And I remember sitting watching the TV with my wife, and I'm hearing yay, nay, yays, nay. And my wife says, damn, did you get the job or not? It's like doing the counts. And then I became the first Surgeon General in history to be confirmed unanimously by the U.S. Senate. So, I figured when the press asked me why, I told them, I said, well, I pissed off both sides pretty equally, over the years. And they said, well, how come you, though? Why would you get the job? And I have a little funny bone in me. And they asked me a couple of times. I said, well, I'll tell you why. I said, the only reason I could have gotten this job is maybe the most far-fetched in federal hiring practices. I was qualified, And the White House says, yeah, it was funny, but you shouldn't have said it. But, I still get goosebumps thinking about it. Because like I said, so back to your question, the best I can say, work hard, do the job. Somebody will spot you doing great things in the community, and hopefully you get the job. For now, you have to be a physician. The Army, Navy, and Air Force have had a nurse a couple of times, and I think that would be fine as well, in my opinion, but the legislation would probably have to be changed. Yeah, Lupita? Oh my gosh. So Lupita said the story with Senator Kennedy. So I was nominated by President Bush, and then you go to confirmation process, and then you get the call, and it says, come to the Senate anteroom on this day at this time, and you will be afforded the privilege to go before the U.S. Senate and have questions and answer questions. And that really is where the decision is made. So I came to know Senator Kennedy pretty well through my discussions with him, and really, irrespective of the politics, kind guy, good guy, and probably the guy that knew the most about healthcare in Washington at that time. Really understood CMS, all of the things that confuse people. So he was the chair of my confirmation committee. So he said, Richard, I want you to come up. I think it was 9 o'clock. Come over to the anteroom. I'll be waiting for you outside. You can bring your wife if you want. I said, okay. So we come up. I see him. I said, Senator, thank you. I really appreciate it. All the accolades I could give him. And he's looking at me, and he's looking at me like a father looking at his son, And then he has my one hand, and he has his other hand on my shoulder. He says, Richard, this may be tough here. My friends will have things they want to bring out in public and may have nothing to do with you. That's okay. He said, but this is the way the process goes, and there'll be some really material questions as well. And so I'm holding his hand, listening to him. He says to me, but I want you to understand the process. And he says, but I want to give you some advice as well. He said, when you come to Washington, you need to bring a dog if you want a friend. And I said, Senator, I've heard that before. That was Harry Truman that said it, I think. He said, you're right. He said, but nevertheless, you understand what it means. I said, fine. So I went in, I had my confirmation hearing, and eventually I got confirmed unanimously by the Senate. But later on, in various committee meetings, I would see them when I'd have to testify at Congress. And we were in a closed session one time on national security, and he was there chairing it. And every time I saw him, I would go back and thank him because he was so kind to me. And yet, the thing I loved about it was the bipartisanship. A Republican president nominated me, and a Democratic senator embraced me, which to me denotes what we should be doing in this country. So I used to say, Senator, I just want to thank you again for how kind you were. He said, Richard, you don't have to thank me anymore. You don't have to thank me anymore. But after about a year, he said that to me, and I said, but I have to thank you, and I have to tell you, I disagree with what you said. And he said, what do you mean? I said, well, Senator, quite frankly, I've been here a while now and I understand what you were trying to tell me. And I think you were wrong in telling me that I need to bring a dog. And he says, well, I don't understand why. I said, well, you have to bring 2 dogs because one of those dogs will turn on you during your term. So after I left, I heard he started using that with other people and telling them that as well. So he always gave me credit for it, Phil. Other questions or comments? Oh, do we have one there? Yes, ma'am.
Dr. Carmona, thank you very much for your candid talk. I worked at the U.S. Senate on the redress for Japanese Americans during World War II.
Yes.
As you know, there were 2 camps here
Yes.
at Gila River and at Poston. My concern today are the detention centers here in Arizona and across the nation, and I think it's a public health crisis. And I'd like your comments on that. Thank you.
I'm very concerned about the lack of humanity in those centers. Okay, if people do something illegal, they have to pay the price for it. But we are better as a nation than abusing people, denying them, separating children from their parents, things like that. To me, that's criminal. Okay, I mean the fact is the failure here is that our elected officials have not given us a immigration policy that works. They've been since I was there. In fact, Senator Kennedy and Senator McCain had such a thing, and we missed it by 1 vote back when I was Surgeon General. The pathway to citizenship and all of that. So I think that we need real leaders to step up and solve the problem rather than using it as ammunition to blame the other side. Number one, and in the interim, I think we the people need to speak up that even if people are there illegally, that has to be adjudicated for sure. But we should treat people humanely. They should be fed, they should get medical care, and if they need to go back, they go back. If we had a policy, like many other countries do, that defined immigration, who could come, when they come, why aren't we recruiting immigrants who have degrees of areas that we need? We have the lowest birth rate in history, and we have seniors. We can't sustain this world the way with our low birth weight and so many old people. So there's a lot of things that we should be thinking about, big picture, that are not political. Let's get people to come here who are smart, who want to work hard, and so on. We have to vet them. We don't want bad people coming in. But there is a way to have a process to do that. And that's what I'm arguing for, which is bipartisan. Absolutely. Right now, as a nation, I think we're failing at that. Any other comments, questions?
Is this, okay, there we go. Hi.
Okay.
I spent most of my career up to now working implementing PEPFAR globally.
Thank you.
Yeah, thank you. I think it's very difficult to overstate how important PEPFAR was in terms of establishing global health infrastructure beyond just delivering HIV care and treatment and saving lives. The laboratory infrastructure, the supply chain infrastructure, the armies of community health workers that were trained, all of that we saw play out very much in real time during COVID. That all of these resources were available to deploy all over the world. And I think most of that is attributable to PEPFAR investing in these countries. So thanks for your comments on that. I think that you could claim more. My question is, you said toward the end of your talk that global health is not charity, it's strategy.
Yes.
And having recently returned to the US, I have observed that I think much of the American public would disagree with you on that. And much of our leadership has also abandoned that position. And I'm curious what your thoughts are about why that change has happened and what your response to it would be.
Well, I don't know specifically who you're speaking of, but I know there are elected officials out there, appointed officials, who don't feel that it is our responsibility to worry about the rest of the world. And I look at PEPFAR as one of those things. Just you say it, okay, feeding children. I mean, all of those that I had up on that slide, all of those agencies actually were, I think, exemplified the best of who we are as Americans, okay? Because not only, it wasn't charity, it was, in some cases you could say, yeah, I'm feeding poor kids, it's charity. But on the other hand, it's strategy. Because if they're fed and they're growing up to be good citizens, and there's no mass migration and there's no wars, then that's a strategy. Okay, so I can look at it from both sides. So I'm a little disappointed at how it's being handled. I think that we can do much better as a nation. And again, looking at what General Marshall and the Marshall Plan did to stabilize the world after World War II, and that was just the World Health Organization, the World Bank, and the United Nations. That's where it started. But that brought stability. You had a forum where people with different opinions could come together, okay, and have discussions about what's going on. Now, it wasn't perfect, but absent it, you had nothing. And so I still think that there's a lot we can do to make the world a safer place. And I would hope that American leadership would step up once again and see the value of having a global policy that embraces and helps others to rise up rather than aspiring to isolationism, which ultimately is not going to be a successful strategy. That's it. You know, you isolate yourself, nobody's going to want to come here. Tourism will go down, trade will hurt. So I think there's a happy medium that we can accomplish. And I think General Marshall showed us after the Second World War how that could be done. And those were wise investments in creating a stable world. Other comments or questions?
Dr. Carmona, I
Yes.
have a question online for
Yes,
you.
yes.
From Jason Coble. From your past experience, where do you feel the medical community within the U.S. military can impact global public health the most?
Oh, that's a great question. The military and global public health. Well, we have soldiers, sailors, airmen all over the world. Where they have impacted the most, I would say right now, is that the lessons from combat casualty care reach our emergency rooms and we resuscitate average Americans better. Use of tourniquet, use of new types of airways. A good friend of mine, a former Navy SEAL who became a doc, Frank Butler, ran the Tactical Combat Casualty Care Group. So every day there is a grand rounds around the world for all the injured soldiers to make sure they're getting the best care possible. And what we're seeing now in the data is the young men mostly who are casualties in war are surviving injuries that were unsurvivable a decade ago because the science has advanced. We're able to deliver blood as a resuscitation fluid in the field. Okay, you never could do that before. There's ways to do that. There's drugs that are being given. There's rapid access to airway. There's the use of tourniquets, which were outlawed when I first started, but yet there's hundreds of cases demonstrated where lives were saved by placing tourniquets and monitoring them carefully. So the military continues to be able to provide accelerated knowledge that gets transferred to our civilian EMS systems, and our EMTs and paramedics then use that to better us in the civilian world. And many of the paramedics and EMTs, as you know, are reservists in the Army, Navy, or Air Force. So those skills are brought in. So the history of emergency medicine in this country is largely driven by casualty care, going back even to the Civil War and the first ambulances and things like that. So I think that we owe the military a great deal for a lot of reasons, but the intellectual property that we take through accelerated learning in a combat situation is benefiting all of us every day. Other comments, questions? No? Are we okay? All right. Thank you all very much. Happy to be with you.
Well, I would like to take this opportunity to thank Dr. Carmona for being with us and for his inspiring lecture. And this is a small token of thank you on behalf of the MESCOF.
Oh, thank you, man. Thank you very much. Thank you. Thank you. So kind. Thank you. Let me take this down.
Do you want to?
Oh, you want to take it?
You want to take it?
Okay. Take a picture with the boss.
Thank you. So I would like to thank you all for being with us today, and we were looking forward to seeing you next year in the next lecture. And with this, we still have food around. Dr. Carmona will be around. We still have the room until 7, so feel free to mingle. He will be around to answer any questions and get to network. And thank you all on behalf of MESCOF. Thank you.